of shots. One is epidural, which is going into the epidural space, and is like a kind of like a blanket injection. And then second is a facet joint injection. Facet joint injection is right in the joints of the spine. They can also do the epidural shot in the neck, but it's very dangerous. It can cause paralysis. So a lot of doctors wouldn't do the shots in the neck for epidural injections, just because it's so risky. We all know the opioids, the things have changed, and especially in the state of Arizona, there's a restriction now. Again, this is not the first choice. Generally, we start with whatever we discussed, and then we kind of like, if we need it, we use opioids. It has its own problems and everything, but it's also, you need it. So if the back pain is affecting your social life, and you have tried everything, because the shots wouldn't last too long. They would last for a few weeks or a few days, and that's it, So if there was acute flare-up, the pain will probably go away for a few days and then probably will stay like that. But if it's chronic pain, it will come back after a few days when the shots effect is over. So you will need some pain management. At that point, we send the patient to pain management. Now, acupuncture is also another option. Acupuncture is done, they actually stimulate the nerves, people who know how to do it. It actually sends a signal to the brain, and brain releases some chemicals known as endorphins. That will make you euphoric. It's like you will feel like in a state of happiness. And when people are happy, they don't feel pain that much. So basically, you're using the body's electrical system to fool yourself that there's no pain. So we're not curing it. But in Chinese medicine, the concept is there's the blockage to the flow of energy, and that's why we get sick. So basically, you're restoring the flow of energy. Well, whatever the concept is, it works, But the scientific reason is that what I just mentioned. Okay, so next is the HOCOMED. We do that in our clinic. HOCOMED is just like a huge TENS unit. It's not actually the TENS unit, but you can. For conceptual reasons, you can think that way. If you're pregnant or if you have a pacemaker, you cannot use this machine because of electrical thing or any electrical device in your body, like cochlear implant or, brain implant. There's a deep brain stimulator. Sometimes people have it or morphine pumps. So what it does, it actually stimulates the nerves, and it have different programs. It is actually made in Germany. It's a pretty expensive machine. You can see this machine. So what it does, it give different programs every day. Generally, it's done for 5 days in a row, and it helps to improve the circulation to the parts of the body and help with the pain relief and everything. Now, okay, so I think we need to talk about the laser surgery because everybody asks, and there's a lot of hype on minimal invasive surgery like spine surgery done by laser, and I know these people are advertising a lot on the TV nowadays. So so there's no fact. Actually, it is just a money-making system. The laser is actually seem very fancy, but the reality is that it's like a scalpel. So instead of using a mechanical scalpel, you're using laser to cut your skin and the tissues. So there's actually some downside because surgeon cannot feel, it doesn't have that kind of perception how much force they're using with the laser as versus scalpel, because they can see if they're going too much pressure they're applying or too little pressure. So in the lasers, there's no such perception. So it has actually no extra benefit. As a matter of fact, it has a downside because you don't have the contact with the scalpel in the real world. Other thing is it's not covered by insurance, so if you need it, they will charge you like $25,000-$30,000, and I don't see any benefit. So when people ask for it, I say, well, don't do it because the idea is that have a small scar. So any surgeon who is trained on doing minimal invasive surgery, they can use a small scar, just like doing a laparoscopic surgery, because before they used to cut open everything. Now they do a little bit of scar and go through the laparoscope. The same thing is available with the spine. So anybody who does a minimal invasive surgery without laser is as good as with laser, and they are covered by the surgeon, by your insurance. So don't get tricked by those advertisements. It looks fancier, like, oh, we're using laser, that's why it's good. There's no difference. When they open you up, it's the same exact procedure, and the outcomes are the same, so no difference. Prolotherapy. So this is basically an old technique. I mean, not covered by the insurances, so a lot of doctors don't do it. It was very inexpensive, actually. It's very inexpensive, very easy to do it. So instead of doing cortisone injection, you actually use the dextrose, which is actually a high concentrated sugar mixed with some other chemicals. You inject into the portion of spot of injury of your joints, and what it causes is it causes inflammation and tricks the body to repair the injured portion, because body wouldn't repair a little bit injury, but if you cause it more inflammation by this injection, the body will start full response and will cause healing of the injured tissue. So it is also used very commonly in sports medicine, but also used in everyday medicine where it is covered or available. Now, another kind of injection you can get in the back is also known as platelet-rich plasma, PRP. So you can see we draw the blood, we spin it, centrifuge it, like spin it high speed. It separates into different layers. The bottom layer is red blood cells, and the layer on the top, we call it buffy coat, is the white blood cells and platelets. You see platelets and white blood cells right there. So then what we do is we remove this portion, just this portion, which has platelets, and we agitate them, like break them, like shake them. It breaks down, the platelets break down, and they release certain chemicals which causes things to grow. So basically your own blood will draw it, then we spin it, then this layer will get separated, we'll remove this layer with the injection, and we shake it well, so break down the cells. When the platelets are broken down, platelets are the same cells when you bleed, it stops your bleeding. There are three different kind of cells in the blood: white cells, red cells, and then the platelets. And the platelets are the one which causes bleeding to stop. The platelets are also which causes your strokes and everything. If you make too much clots inside your body, it can cause stroke. So it's not supposed to make clots in the body. It's supposed to make clots when you are cut, when you have injury or something. But anyway, that's their general functionality. So mainly what you're doing now is using that concept that you have that cells which are which you have agitated and they have broken down and they're releasing that chemicals. You can inject in the site of injury, and they will cause those growth factors to grow the injured ligaments and cartilage and everything. So this is also done very commonly in sports medicine. Same thing like prolotherapy, but a different one. So like a different option, I guess. Now this is the new one. This is the one we actually wanted to talk today. Stem cell injections. So we did talk in the previous seminar about stem cells in anti-aging medicine, and this one is different. This is actually first thing we have to define what are the stem cells. The stem cells are the cells which are like not mature yet. They can grow in any kind of cells, and our body have that. I mean, we don't need it from embryo or from placenta or anything. All human beings have stem cells in their body, in the bone marrow. So in the bones, there's a space known as bone marrow. So, we can remove it, we can shave off the bone, take the stem cells, and same thing, mix it with the blood and inject inside the site of injury. So we have talked about 4 different kind of injections. Cortisone injections, we talked about the Prolotherapy, we talked about platelet-rich plasma, and the last one we are talking now is the stem cells. So stem cell is the most latest technology, and this is what we're talking today, because rest was kind of like the scope of management of the back pain. But stem cell is something new. It's not widely available yet. Some big centers are doing it, not covered by the insurance. Procedure remains a little bit more lengthy. You have to remove the bone marrow and mix it with the blood, and then you inject in the site of injury, just as you would do other injections. Now, so the stem cell can change to any kind of cells under the right circumstances. So it can change to nerves, it can change to muscles, cartilage, wherever you put it in, the cell will change to that kind of cell. So you're actually repairing your injured cartilage with your own new cell.